It is also called as the familial, hereditary, or the spinal ataxia. The definition of the ataxia, it is an autosomal recessive familial or the hereditary disease characterized by the degeneration of the ascending and the descending fiber of the spinal cord, including the spinocerebellar tract. The etiology of the ataxia, first one is the idiopathic, which is unknown. Second one is the hereditary caused by both males and female are equally affected. Third one is the genetic disturbance, for example, Down syndrome. And the fourth and the last one, the disease started from the childhood, but the symptoms are manifested in adolescence period. The pathology of the ataxia, so loss of the cell in the dorsal root ganglia, which leads to the secondary degeneration in the posterior column and the spinocerebellar tract, and it's led to the degeneration of the corticospinal tract. Cerebellum is affected, which loss of the Purkinje fibers, uh, cardiomyopathic changes resulting in the atrophy and the muscle fibrosis. Now, the clinical feature of the ataxia. Clinical feature of the ataxia. Clinical feature of the ataxia. First one is the ataxic gait. Ataxic gait, it leads to the foot slapping gait, high stepping gait, staggering gait, wide base gait. Second one is the motor restlessness, which look like a chorea. And third one is the tremor. In tremor, it include the intentional tremor in arm, head, and neck. So this is the main symptoms of the phagic ataxia, which include the muscle weakness, impaired speech, skeletal issues, neurological problems, cardiomyopathy, difficulty in swallowing, lack of muscle coordination. Now the next one is the muscle tone, which includes the flexor muscle spasm. So the muscle tone is most common in flexor muscle. So, and the second one is the reflexes. In reflexes, there are plantar reflex, extensor reflexes, Babinski sign positive, reflex are exaggerated, and knee jerk is lost. Then, next one is weakness of the limb and a nystagmus. Then, dysarthria. In dysarthria, the scaling of speech, hesitant, and the hot potato type. Hot potato type, each sound or the knot is sharply detached or the separate from others. Then next one is the dementia and decrease in the intelligence. Next one is the sensory changes. In sensory changes, loss of the fine touch, vibration, position, and kinesthetic sensation, suppression of the vestibulo-ocular reflexes, and paresthesia. The musculoskeletal deformity, in musculoskeletal deformity that includes the kyphoscoliosis, and pace caves. Then the next one is the other problems. Other problems it include diabetes mellitus, arrhythmias, and cardiomyopathic changes. These all are the clinical features. Now, next investigation. So, which are the investigation which are necessary to diagnose the ataxia? So, the first one is the nerve conduction velocity study. Second one is the CT scan. Third one is the MRI scan, and fourth one is the evok potential. These all are the investigation are useful to diagnose the ataxia. Now, the medical treatment for the ataxia. Medical treatment for the ataxia.